What is an IUD? It's short for intrauterine device because it sits inside your uterus, your womb. But it's also called a loop or coil. That's much easier to say. It's a small plastic and copper item that is placed inside your womb. It prevents the man's sperm from reaching the egg and makes your womb unlikely to hold a pregnancy. The IUD is one of the most effective contraceptives. It lasts up to 10 years, but can be removed at any time by a provider, so you can get pregnant again immediately. IUDs are great for women or couples who want to wait a few years before having a child, or who aren't sure if they want any more children. New mothers can also have it put in directly after childbirth, as the IUD is safe to use during breastfeeding. IUDs are ideal for those who want a hormone-free method, or a discreet method of contraception, as no one can see that you're using it. The most common side effect of an IUD is heavier, more uncomfortable or longer periods, though this improves after a few months. Some countries offer an IUD with hormones, called an IUS. It's very similar to the IUD, except that it lasts for up to 5 years. An IUS is a good option for women who have heavy or painful periods, as it can reduce pain and make monthly bleeding lighter, or even make it stop. Best of all, it can reduce any weakness that results from heavy bleeding each month. Inserting an IUD or IUS is a simple procedure. It only takes 5 minutes and it works immediately, and you don't have to remember anything afterwards. Both are safe for women who have never had children, but may hurt more when inserted in women who've not had children. The IUD and IUS have strings which hang down into the vagina to help a provider remove it. You can check the strings with your fingers. Most men will not be able to feel the IUD or IUS during sex. However, if they do, it's not painful and the strings will soften over time. Some women may have more discharge from the vagina, but this is not dangerous. Very rarely, the IUD may fall out in the first few months of use. If this happens, contact your health provider immediately, as you're not protected from pregnancy. The IUD and IUS do not protect against HIV or other sexually transmitted diseases. So if you're worried about this, use a condom at the same time. And just to clear up some myths, the IUD or IUS does not move around your body. It can't swim and doesn't have legs. It sits inside your womb like a baby would during pregnancy. And just as the baby doesn't move anywhere, except out when it's ready to be born, the IUD can't either, unless it's removed by a provider. Finally, the IUD does not cause cancer. In fact, IUDs may reduce the risk of certain types of cancers. If you or your partner are interested in finding out more, speak to your friendly Marie Stopes provider for confidential information and advice that you can trust.